General safety measures. They are the processes to be followed to ensure safety while working in a laboratory. The importance of laboratory safety. A laboratory is an area which is filled with the risk of exposure to various hazards. It is important to define all the hazards in a laboratory and formulate plans for their prevention and control. A laboratory safety program protects not only the employees and patients, but also the laboratory equipment and facilities, as well as the environment. The active steps which must be taken are: provide safety training to all staff, conduct safety awareness programs, and ensure fire safety drills and regular safety audits. The general steps to be taken towards improving laboratory safety are: providing infrastructure support, designating a safety officer, designing a safety program with specific protocols and preventive and remedial measures for each kind of identified hazard, preparing a safety manual, identifying safety indicators and defining safety objectives, conducting safety audits, making available first aid kits in the laboratory and installing eye wash stations, and maintaining general laboratory cleanliness. The specific areas to be addressed are listed in this flowchart. They are: reporting accidents, understanding specifics of all laboratory hazards, standard precautions, which is made up of several components like hand hygiene, PPE, handling of sharps, respiratory hygiene and cough etiquette, linens, waste disposal, patient care equipment, and environmental cleaning. The next is immunoprophylaxis or vaccination of all healthcare employees in the laboratory as well as the entire hospital. Post-exposure prophylaxis, which is also discussed in detail separately, and other measures to avoid biohazards. The first critical part of laboratory safety is reporting of accidents. All injuries or unusual incidents should be immediately reported to the supervisor. Reporting of incidents must be encouraged by investigating the incident or accident and not the person involved. Root cause analysis of all unusual incidents must be done, and corrective and preventive actions must be taken. It is also important to report a near miss so that measures may be taken to prevent its occurrence. The next is standard precautions, which has 10 elements under it, and they are: hand hygiene, personal protective equipment like gloves, facial protection, and gowns, management of biomedical waste disposal, handling of hospital linens, management of different kinds of spills, respiratory hygiene and cough etiquette, prevention of needle stick injuries and occupational exposure of healthcare workers through proper handling of sharps, environmental cleaning, and finally, handling of patient care equipment and patient isolation. The next area of focus is immunoprophylaxis. The three commonest blood-borne viruses are HIV, hepatitis B virus or HBV, and hepatitis C virus or HCV. Among them, hepatitis B virus has the highest risk of transmission, almost 100 times greater than the transmission risk of HIV. Yet, it is completely preventable due to the availability of the hepatitis B vaccine, which is given as 3 doses at 0, 1, and 6 months. Therefore, hepatitis B vaccination must be given to all employees at the healthcare facility. Verify the seroprotection status after completion of the 3-dose vaccination series by measuring the titer of antibodies to hepatitis B surface antigen. Any value more than 10 milli-international units per ml is considered as protective antibody titer. In a study by Mahoney et al., they looked at the impact of the 1991 OSHA mandate to vaccinate all healthcare workers against hepatitis B virus. OSHA stands for Occupational Safety and Health Administration. As you can see in the graph, before the OSHA mandate, the number of hepatitis B cases among healthcare workers were around 17,000, whereas after the initiation of the vaccination for all healthcare workers, the number of hepatitis B cases among them reduced to 800. So there was more than 95% decline in the number of HBV cases among healthcare workers. This regulation had the greatest impact in eliminating HBV transmission among healthcare workers. Another area of interest is availability of post-exposure prophylaxis. It is best to initiate it within 2 hours after an exposure. There is only very minimal benefit if it is initiated more than 72 hours after the exposure. PEP for HIV needs to be continued for 28 days. There is no recommended PEP for exposure to HCV. The testing of source patient and healthcare worker may be helpful, along with the monitoring of liver enzymes. Laboratory follow-up for needle stick injury is mandatory as per NACO guidelines. Other precautions taken to avoid biohazards are no eating or drinking within the laboratory, not even after working hours. Absolutely no food or drink must be stored in a laboratory refrigerator. No mouth pipetting. It is a procedure that has been banned across all laboratories. Care should be taken to minimize aerosol production. To summarize, general safety measures in a laboratory were discussed in terms of reporting incidents, standard precautions, immunoprophylaxis, post-exposure prophylaxis, and good laboratory practices. Thank you.